Mount Carmel and Ohio Health both received their first shipments of the vaccine. Ohio State University's Wexner Medical Center hasn't, but says it expects to receive it sometime this week. This, of course, comes 1 week after Ohio started receiving Pfizer's vaccine. Last week, healthcare workers and nursing homes began getting immunized. And with these two authorized vaccines, many of you have asked, what's the difference? Well, new tonight, 10 TV's Angela Reighard breaks it all down for you.
Yeah, so there are some similarities here and some differences, but is one vaccine better than the other? Let's take a look. The first thing we have to talk about is how these vaccines work. Traditional vaccines, like the flu shot, they put a weakened or inactivated germ into our bodies. But mRNA vaccines are different. They actually teach our cells how to make a protein, or even a piece of protein, that then triggers an immune response. Our body makes antibodies, and we're protected. Now that's out of the way, you should know both Pfizer and Moderna's vaccines are mRNA vaccines, and their effectiveness is about the same. Pfizer is at 95%, Moderna is close to that, around 94%. So how many doses will you need? The answer is 2 for both, but the time between those doses is different. For the Pfizer shot, your booster is going to come 21 days after the first dose. Moderna's follows after 28 days. The biggest difference between these two is how they're stored. You see, Pfizer's vaccine has to be really cold, like colder than winter in Antarctica. Moderna's also needs to be frozen, but think of a temperature closer to your freezer at home. So which vaccine should you get? Well, Pfizer's is for people 16 and up. Moderna's is 18 and up. But is one better or even safer than the other?
After the FDA does the authorization, the CDC does the final recommendations. And at this point in time, one COVID-19 vaccine is not recommended over the other. You know, when 2021 gets here, there's still a lot that we have to learn. And as time goes on, we may learn that one vaccine performs better, for example, in those that are 65 years old, kind of like we have with the flu shot.
When it's time for you to get your vaccine, you're likely going to get a card that tells you which one they used. Now, when you go back for your booster shot, you want to make sure you get the same one. I'm Angela Reighard. Back to you.
Angela, and 10 TV is dedicated to keeping you up to date with all things related to the COVID-19 vaccine. We put together a vaccine tracking team that will track the vaccine as it becomes more available, as well as any issues that may pop up.